let's talk about the cold cap to help with preventing hair loss. So my experience was that I said before I would give it a go, and they bring in this, looks like a diving helmet, but that only comes around to here, and it's been in the freezer. They've kept it frozen, and they keep it connected, and they put that on top of your head. A friend of mine had said, take some paracetamol before you go, and then the discomfort won't be too bad. But I absolutely hated it. It's not for the faint-hearted, but it does work for some. So I endured it, and then when they were giving me my injections of the FEC, and they were talking to me, that did take my mind off. So the first time I used it, and my hair did get thin by the next time, which was 3 weeks later. So the second time was more uncomfortable because I had less hair between me and the cold cap. And by the third time, which was 6 weeks later, I had lost so much of my hair that the cold cap was pretty much on my scalp. So at that point I thought, well, you're just torturing yourself for nothing, and I decided to stop using it. On the other hand, two of my friends, the two Carolines, both used it and didn't lose their hair. And that was on the first occasion. One was about 10 years ago, one was about 6 years ago when they had breast cancer. So I think for everybody, it's worth giving something a go, but just don't have high expectations, and do be prepared that it's uncomfortable. And if you've got very thin hair, it can be a bit painful. So the first chemo, what to expect. So they made me an appointment to have my bloods taken, and because you go to the hospital, you see a nurse who's doing this job every single day, and they are amazing at getting blood out of you, because I've always had small veins deep in my arm. You know, they were always patting away and getting me to do this sort of thing, and really criticising my veins, which is fair enough. So it wasn't going to be easy from that point of view, but they always succeeded in getting the blood out pretty painlessly. And then as long as your levels of white and red blood cells are high enough, then they will let you go ahead with the chemotherapy. So I'm guessing that my first one, when I had Campylobacter, hadn't affected my white blood cells at that point. It only happened later when my immune system went low from the chemotherapy about a week later. So then where you go for your treatment. Now, I was very fortunate that we have a local charity based in Cardiff called 10 of Us. And that was set up, I think, back in the 50s by 10 people, and that's why they called it 10 of Us, who wanted to help with cancer treatment, and then funded a charity to get it going, and they've been raising money ever since. And what they do is a lot of research, but they provide mobile units so that people in more outlying areas in Wales have access to the chemotherapy without having to travel too far. Now, first of all, that's okay when you're having the injections, but when you have it in a drip, then I needed to go to the Velindre Hospital in Cardiff. So what they do is they put the injection in the back of your hand, in the veins in the back of your hand. So 1, 2, 3, and then 1, 2, 3, 6 lots of chemotherapy. They come along with these great big tubes that look like something out of a comic sketch. You think, well, you know, nobody's going to use a tube that big. But obviously the needles, it doesn't matter about the needle because they're just putting it into the intravenous needle that's in your arm. So they're just not putting a needle in each time. And it does take a little while for this to go through, but the nurse chatted away to me at the time, and we talked about Spain, and I talked about my husband and I dream of buying somewhere, holiday home in Spain. And the time passed, and she was very kind. And they had given me a little educational piece before we started about what to expect, so it wasn't a surprise. And there was a lady on either side of me, so there's only about 3 of us at a time. So my husband went off and did some shopping because they're in the mobile units, there's no room for visitors to be with you. And interestingly, while I was there, a lady came in and I could hear, she was the other side of the screen, I could hear her saying, I've come for my Herceptin injection. So she was obviously HER2 positive as well. And she said, oh, I'm still here, and I think this is number 140 or something. So I asked the nurse, I said, oh, I'm going to have Herceptin. I'm not going to have it for that long. She said, oh, no, Herceptin is a wonderful drug that someone who has a secondary cancer but is HER2 positive can receive that indefinitely, and it will stop the cells from multiplying, which is the problem if you're HER2 positive. And I'll do an episode on that. So obviously after that, you go home, and in the first few weeks when I had the conditioner on, wash my hair, couldn't wait to. And I felt fine. And even the next day I felt fine. I took the medication that I was given, everyone on time, because I thought they know what they're doing. I can remember my mother saying, oh, I'm not taking the anti-sickness tablets, and she was feeling worse. So they really helped. And then the steroids, some of them are usually steroid tablets to give your body a boost. But what I wasn't expecting was that when I stopped taking the steroids, I'd kind of go downhill, and I was very whippy. So that is why I didn't go back to work on the Tuesday following. I went on the Wednesday because Tuesday was my day for being tearful, and by Wednesday I felt more like myself again. So you have your tests, you have your chemo. Then the district nurse came, and she was lovely, and she came to give me an injection to boost my immunity. And she then did it, pinched my skin on my tummy, which there was plenty of, and put it in, and it didn't hurt, it was fine. But then she said, so I will train you how to do this yourself. I said, no, I don't think so. No, you can do it, you can do it. So I'll read you the chapter I wrote about the district nurse. June 2016. So I had my plan. I calculated the weeks that it would take if everything happened on time, i.e. all the chemo sessions, surgery and radiotherapy. I had my Excel spreadsheet and I'd gone through the calendar counting out the weeks. I also prepared a colour-coded chart for work showing when I would be having blood tests, chemo, surgery, mugger, heart scans, and when I would be in the office. I was explaining this to my lovely district nurse while she was training me to inject myself. I said, I've worked it out, and if all the chemos happen on time, then the surgery exactly 4 weeks later, then the radiotherapy 6 weeks after that for 3 weeks. I should be done by the 15th of December. I wasn't sure she was listening to me as she said, so take the syringe, pull off the cover, exposing the needle, grab your tummy like this, push the needle in. I recoiled. You have got to be joking. She reassured me. No, honestly, it will be fine. Just don't look at the needle, push it in, then push down the top until it clicks. I can't, I protested. Yes, you can. Just push, then click. I held a chunk of my tummy, closed my eyes and pressed down. I didn't feel a thing. Oh my God, I actually did it, I gasped. She said, that's what diabetics have to do every day. Wow, I said. My niece is diabetic. She's had to do that for years. Don't worry, we'll go through it again next time. I won't just abandon you. I sat deflated as the nerves passed and said, I can't believe what a baby I was about it. My pride is wounded after all the surgeries I've had and procedures in my life. Thinking I knew so much about medicine. What a wuss. She smiled and said, don't be too hard on yourself. It was your first time. She was sitting on the floor at my feet and stayed there while kindly saying, don't get too fixated on these dates, will you? Things don't always go to plan, and I would hate for it to affect you negatively if you don't achieve your goal. Of course, she was right, and I acknowledged that, but as usual, needing to have the last word, I said, okay, fair comment, but at least Christmas Day is a Sunday this year, and I don't think they do radiotherapy on weekends, so perhaps I can still count on being free that day. She nodded and smiled. Then she said, I should tell you that when I had to inject myself, after years of injecting others, I struggled with it too. So you can look forward to those weeks in between the chemo and after you've finished the steroid tablets and you've had your little cry and you start to feel better, that every day you feel a bit better. And I went back to work and that took my mind off. It was a struggle, it was hard. And I'll talk about working in another episode, but just keep thinking about I'll start to feel better.